Hi there everyone, Dr. Ferdy Miranda here. Today, I plan to enlighten you with intriguing details regarding oral cancer. Ever wondered about its initial symptoms? Identifying these could potentially save a life. We'll delve deep into the chief symptoms and signs of oral cancer, as well as the main causes and risk factors related to this illness. These primarily include tobacco and alcohol consumption, HPV infection, and prolonged sun exposure. It's also significant to mention that oral cancer tends to be more prevalent in men and those above the age of 40. Armed with this knowledge, you'll be better prepared to identify and understand this disease. First on the list is mouth sores. These often manifest as small, painful ulcers or blisters inside your mouth. They can appear on your gums, lips, tongue, or even the inside of your cheeks. Distinctive in their white or yellowish center and a red border, their occurrence might seem mundane. But if you notice persistent sores that do not heal within 2 weeks, it's a cause for concern. These resilient mouth sores might be indicative of a more serious underlying health condition, such as oral cancer or a severe vitamin deficiency. Hence, it's important to not dismiss them and seek professional advice promptly if they persist. Next, keep an attentive eye out for the appearance of red or white patches. These anomalies can be characterized by their irregular shape, differing in size, and can often be found on the inside of the cheeks, on or beneath the tongue, or along the gum line. These unusual colored patches in the mouth are not to be taken lightly, because they can be a sign of something more serious. They break the usual hue of healthy pink that our mouth interiors typically have, and might indicate conditions ranging from infections, inflammations, to precancerous changes and oral cancer. The third warning sign is the presence of unexplained lumps or a thickening of the skin. These anomalies can often be found on the inner cheeks, gums, or bottom of the mouth, though in some cases they can appear on the roof as well. It is not uncommon for them to exhibit an irregular shape and a hard, rough texture. They are a cause for concern because these lumps or skin thickening can sometimes indicate an underlying health issue. This could range from a simple infection, which your body is fighting off, to more serious conditions like oral cancer. Therefore, any such changes in your mouth's regular texture should be a reason to seek professional medical advice. A crucial sign that warrants your attention is the experience of difficulty swallowing, also referred to as dysphagia. This complication can emerge as a persistent challenge or inflict a sense of pain while swallowing. It's not just about the physical discomfort. Dysphagia can often be a symptom of underlying issues. It could be the result of conditions like GERD, esophageal spasms, or even more serious issues like esophageal cancer. It's not something to brush off lightly, as continued difficulty in swallowing can lead to malnutrition and dehydration. Therefore, it's crucial to not ignore these signs and seek professional medical advice when they persist. A persistent sore throat, characterized by a continuous discomfort or pain in the throat that lingers for weeks, could be caused by various factors. It might be an aftermath of a common cold or flu, allergies, dry air, or even gastroesophageal reflux disease. Despite its benign nature, often, a persistent sore throat that doesn't improve even after a few weeks of home remedies and rest might be a red flag. It could be indicative of more serious conditions such as a throat infection, tonsillitis, or in rare cases, throat cancer. It is crucial to pay attention to this symptom and seek medical advice if it persists. Alterations in voice, such as persistent changes in volume, pitch, or tone, can be indicative of an underlying issue. These could manifest as a raspy, breathy, strained, or even a softer voice. An individual might start to sound hoarse continuously, with their voice seeming strained or broken. They might also experience changes in pitch, where their voice may go higher or lower than their normal range. Another noticeable change could be in the volume of their speech, either too loud or too soft. These changes are not to be overlooked, as they could be signs of laryngeal conditions, vocal cord damage, or even throat cancer. Thus, any persistent or unusual voice alteration warrants immediate attention and a consultation with a healthcare professional. Unexplained bleeding in the mouth, often characterized by spontaneous outflows of blood from the gums, tongue, or inner cheek regions, is a symptom that should never be sidelined. This abnormality could spring from various causes, such as gum disease, vitamin deficiencies, or even more serious conditions like oral cancers. This is why it's paramount to seek medical attention immediately. A healthcare professional can provide an accurate evaluation, take the necessary steps to diagnose the cause, and determine the appropriate treatment. Leaving such symptoms unattended could potentially escalate the underlying problem, further endangering one's health. Finally, experiencing persistent numbness or pain in the mouth, face, or neck can be quite distressing. This discomfort might be consistent or intermittent, ranging from a dull ache to a sharp stabbing sensation. Such symptoms could be the result of various conditions, including nerve damage, dental issues, or even infections. However, they may also be indicative of something more serious, such as oral cancer. Oral cancer often begins with the growth of abnormal cells in these regions, which can cause nerve damage, leading to feelings of numbness or pain. The presence of these symptoms doesn't necessarily mean you have cancer, but they're significant enough to warrant a visit to your healthcare provider for a thorough evaluation. Now that we've covered the signs and symptoms, it's crucial to know how to screen for oral cancer. Regular dental checkups often include an examination for early signs of this disease. In addition to this, regularly inspect the inside of your mouth, including your lips, gums, cheeks, and the roof and floor of your mouth, for any of the signs mentioned above. Remember, if you notice any of these signs or symptoms, consult a healthcare professional for a thorough evaluation. Early detection can greatly improve the chances of successful treatment for oral cancer. So, stay vigilant and proactive about your oral health. It's not just about a beautiful smile, but about a healthy life. While professional medical treatment is crucial, there are also home remedies and herbal treatments that can support oral health. Maintaining oral hygiene is paramount. Regular brushing, flossing, and using mouthwash can go a long way in preventing oral issues. A healthy diet, rich in fruits, vegetables, and whole grains, can also contribute to a healthier mouth and throat. Certain herbs, like green tea and turmeric, have also shown potential benefits in supporting oral health due to their antioxidant and anti-inflammatory properties. However, it's important to remember that these remedies should be used as a supplement to, not a replacement for, professional medical treatment. Always consult a healthcare professional before starting any new treatment regimen. So, while you're being proactive about your oral health, don't forget to nourish your body with the right foods and herbs. After the home remedies and herbal treatments, it's crucial to understand that the definitive treatments for oral cancer often involve a combination of surgery, radiation therapy, and chemotherapy. Early detection plays a pivotal role in successful treatment. Depending on the stage and location of the cancer, various types of surgeries may be performed. This could include the removal of a small tumor, larger surgeries for more extensive tumors, or even reconstructive surgery following cancer removal. Radiation therapy and chemotherapy are also commonly used to kill cancer cells or prevent them from growing. After the treatment, follow-up care and rehabilitation are essential to ensure the cancer has been entirely eradicated and to help the patient regain normal function and appearance as much as possible. With early detection and proper treatment, the prognosis for oral cancer can be significantly improved. Remember, your health is in your hands. Don't delay seeking help if you notice any signs or symptoms. Thank you for staying with us throughout this informative journey. We hope the information provided has shed light on the importance of understanding the signs, symptoms, and treatments for oral cancer. Early detection is key, and it's crucial to consult a healthcare professional if you notice any abnormalities or changes in your oral health. Now, if you found this video helpful, we encourage you to subscribe, like, and share our YouTube channel with your friends, family, and loved ones. By spreading awareness, we can potentially save lives and ensure better oral health for everyone. Stay tuned for more healthcare updates in our upcoming videos. Remember, your health is in your hands, and knowledge is the first step to prevention. Until next time, take care of your health and keep smiling.